We have this insane system now where you need health care, you're the buyer, I'm the doctor, I'm the seller of health care, and somebody else pays the bill. Who the heck is going to shop for price when somebody else is paying the bill?
Across the country, the healthcare debate is heating up. We all want high-quality, affordable healthcare, but how do we achieve that goal? Should we bet on the free market or the government? One thing we can all agree on is that healthcare costs have gotten out of hand.
Soaring healthcare costs.
But healthcare costs are way too high.
If we do nothing to slow these skyrocketing costs, we will eventually be spending more on Medicare and Medicaid than every other government program combined.
Before we can talk about reforms that will work, we need to understand why healthcare has become so expensive.
My epiphany with healthcare came in an unlikely place, Best Buy.
David Greitzer is a Canadian physician who practices medicine in the States as well as Canada. He's the author of The Cure, How Capitalism Can Save American Healthcare.
If you go to Best Buy, you're surrounded by cutting-edge electronics. The funny thing is prices continue to fall with time.
Falling prices is something we've come to expect in the U.S. When we look at the cost in terms of the length of time an average worker must work to afford things, we see clearly that everything from food to jeans to electricity has gotten cheaper over time.
5/6 of the American economy, individual choice and competition works. Prices fall with time, value rises, and people are content. Why wouldn't that work with healthcare?
In fact, it's worked with some forms of healthcare. Dr. Robert Maloney is a pioneer in the field of corrective eye surgery.
I started doing LASIK in 1991 as part of the original FDA trial. So I've been doing it for 18 years, and I've done about 50,000 procedures.
We talked to Dr. Maloney about what's happened in the LASIK industry since the procedure became available in the early 90s.
Prices were about $2,500 an eye, $2,000 to $2,500 an eye. And they stayed that way for a year or two, but then other centers started coming in and the price went down, 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 down because of competition, because a lot of people wanted it and a lot of doctors wanted to offer the service.
And just like computers and televisions, LASIK has gotten better as well as cheaper.
Our modern day lasers are super smooth. We can measure the eyes in ways that weren't even possible 20 years ago. So it's been this incredibly virtuous cycle of improved technology, greater options, and greater results.
So how exactly is LASIK different from other medical procedures?
Insurance doesn't cover LASIK, and that makes the experience completely different for the patient.
The problem with our health insurance industry is that it's burdened by government regulations that create perverse incentives for everyone involved.
It's complicated and it's confused and it's polluted by the tax code.
The answer, say proponents of ObamaCare, is even more government, more regulations, more subsidies, and a law mandating insurance coverage. Can their plan work? Fortunately, we don't have to look any further than Massachusetts, which implemented ObamaCare-like reforms in 2006. Today, Massachusetts residents pay the highest premiums in the country. And worse, MassHealth, the state's Medicaid program, is rationing care. MassHealth denies 23.8% of claims, a far higher denial rate than private insurers in Massachusetts.
There hasn't been a government solution that's worked here in terms of maintaining quality and reducing costs.
So what's the market-based alternative?
I think LASIK can act as a model for healthcare reform.
The kind of reform Dr. Maloney is talking about could be accomplished without creating new government programs or increasing taxes. In fact, a few simple policy changes would increase choice and competition and put us on a path toward a healthcare system that is better, more accessible, and more affordable. The first change has to do with the tax code. During World War II, as a result of wage controls, employers began offering health insurance as a way to compete for workers. A few years later, employer-provided health insurance was made tax-exempt.
And that's why well into the 60s, 70s, and 80s, employers were offering not just health insurance, but a whole lot of health insurance. Not just to cover you if, God forbid, you're stricken with cancer, but to cover you if you decide to go to your physician and ask about better blood pressure management or ingrown toenails.
No one in the right mind would design a healthcare system that operates like an all-you-can-eat buffet, let alone one where employers pick up the tab. But today, 90% of non-elderly Americans have job-based health insurance, and that's simply not fair.
You want to leave your job because you want to do photography, you want to do freelance journalism, you're going to pay for your health insurance in post-tax dollars. You're really punished by the system.
Extending the tax exemption for healthcare costs to individuals would benefit the unemployed and the self-employed, and it would allow people who currently have job-based insurance to choose from a much wider range of insurance options. The second reform? Scale back state regulations and create a national market for health insurance. Health insurance is expensive in part because of regulations like guaranteed issue, which forces insurance companies to provide people with insurance regardless of pre-existing conditions.
From a distance, that seems great. The problem is insurance markets don't really work like that. If we applied those standards to home ownership insurance, you'd be able to buy your insurance after your house caught fire. Doesn't make sense.
Mandated coverages in many states also drive up costs, and needlessly so. Why, for instance, should teetotalers be forced to pay for insurance that covers alcohol abuse treatment?
One has to be very cautious about the best of intentions when it comes to regulations. We need to move in the opposite direction, I think. Make it possible for you to buy a bare bones plan, to shop across state lines.
Permitting people to buy out-of-state health insurance would allow people in heavily regulated states like New Jersey to purchase more affordable insurance plans from providers in states with fewer regulations. The third idea, promote health savings accounts, an affordable alternative to traditional health insurance plans. Combined with high deductible insurance that covers serious medical problems, health savings accounts allow people to set aside pre-tax dollars for routine health care. Money that's not used is rolled over and can ultimately be used for retirement.
With health savings accounts, people would be empowered with their own health dollars, and as a result, they'd ask the sort of questions we don't ask. Where can I get better value? What are prices like? And so on and so on. This is exactly, by the way, what we do, there's no mystery here, for other basic needs like food, clothing, and shelter.
And here's the kicker. Once consumers are back in the driver's seat, healthcare providers will have to offer better service at lower prices in order to survive, just like LASIK surgeons.
With LASIK, because people are paying their own money, they're very sensitive to their experience. Does the doctor make me wait? Does he answer all my questions? Do I get a great result? If there's a problem, I'm out of there.
These reforms are just a starting point. The Federal Drug Administration, Medicare, and Medicaid all have serious problems that deserve attention. But make no mistake about it, we're at a turning point in American history.
I would suggest we look not to Britain for ideas, not to Canada for ideas, but let's look to the other 5/6 of the economy where we have individual choice and competition as guiding principles, and people are satisfied.
You've probably seen ads for hair transplants where they advertise the price, how much it costs per hair. And there's a really vibrant competitive market driving the price down for hair transplants. I imagine the same thing happening for routine colonoscopies, routine mammograms, just routine checkups.
My guiding principle is, and always has been, that consumers do better when there's choice and competition. That's how the market works.
Mr. President, I couldn't have said it better myself. For Reason TV, I'm Nick Lasik.